everybody. So those of you that follow me in LinkedIn will already be aware that I have had a poll running very recently, and it's been focusing on what your top concerns are at the moment in school, trying to figure out what these priority areas are for you. Now, I had a feeling what they would be, and my feeling was correct, though I wasn't quite sure which one would come out on top. Now, there's like 1 or 2% between them, so I'm just going to take and try to address a little bit of both aspects. So the two highest, voted, if you like, was staff mental health and wellbeing, and also access to support. Now, staff mental health and wellbeing, again, those of you that follow me will know that I have done an absolute mountain of things around staff mental health and wellbeing more recently. So I'm not going to develop something new, but I will point you in the direction of how to access all of those things. So there is a blog that was written last month all about staff mental health and wellbeing. Within that blog, there are some links to some very, very useful policies, some very useful resources, and there should be a link to a staff job role risk assessment as well. Top of the list in the terms of priorities for staff mental health, because a lot of staff are feeling overwhelmed, overworked, and like they haven't got the capacity to commit to their role within the kind of time specified that's given in school. So you can access all of those things from that blog. There is also a staff mental health and wellbeing training session. Now, we have two of these, one of which is more so around kind of early signs and symptoms, how to access support, how to get your strategy in place. And the other one is very much pitched to the staff themselves, so it will help them to find practical strategies to support their own mental health and wellbeing needs. And it talks about it from very much a body-based approach as opposed to accessing talking therapies. Particularly important. I'm not going to go into why now, but access that webinar and that will make sense to you. So you've got those two training webinars, CPDs, whatever you want to call them, they're accessible for you guys as well in the way of staff mental health and wellbeing. Now, in the way of accessing support, this can be interpreted lots of different ways. I think what people are referring to is accessing support for children and young people. However, I want to make sure that actually we address accessing support as a holistic thing. So you can access support if you're referring to yourself as a senior mental health lead or a kind of senior leader in school, and your ability to access support. If you are already working with me and you're already with us as a company, then you are able to access your one-to-one coaching with me to help you to address any of these concerns you've got, to iron out any issues around kind of your strategy, culture shift, anything like that. You can access in your one-to-one coaching. You also have access to your peer group coaching as well, which is our termly support sessions where you can really start to network with all of our other senior mental health leads and support each other as kind of you guys being, frontline in the role yourselves. If you are not with us already, so if you haven't already done your training with us, or you haven't, you're not working actively with us, then we still have things in place that you can access to seek support. So we have something called implementation coaching that you can have access to. Now, our implementation coaching is a new service that we have developed because we were very conscious that actually there is a whole host of senior mental health leads or senior leaders out there who need support but cannot get it from us because they're not already with us. So our implementation coaching, something to highlight that I think is really important with this, is it is a 1-hour coaching session. It is on a one-to-one basis, but it's also bookable on an ad hoc basis. So if you want just 1 hour, absolutely fine. If you decide you want an hour today and an hour next week, fabulous. I like to speak to people, the more the merrier. So it's ad hoc. It means that there's no financial commitment from you, and it means that there's no time commitment from you either. You book them as you feel you want them, and you don't have to have done your training with us. You can be anybody across the UK, senior mental health lead or senior leader, and you want some support with getting your strategy back on place, perhaps identifying kind of, this is what I've done so far, these are my next steps. Implementation coaching will help support you with that. If you're referring to kind of accessing support for children and young people, it's really important that in the first instance you look at auditing what you have access to internally. So don't always rely on seeking external input, because that's going to mean that your staff, your support for student mental health and well-being is not sustainable because you're constantly outsourcing, and that means you're going to be waiting on a lot of waiting lists. Meanwhile, you've got children sitting in a system where they still need access to support. So my advice in the first instance would be to upskill your team, upskill your staff, or perhaps even yourself, to ensure that as a school and as a provision, you are able to meet the needs of your children in terms of these low-level early interventions and early support systems in place. Providing, let's say, all of that's in place and you've got a real wealth of access to support for your children and young people internally, and now we're referring to those children who do require external services, then yes, this is kind of a very common area where people are feeling they cannot access support normally due to not meeting threshold, or normally due to the waiting lists. My advice to you guys would be, first and foremost, audit what you have access to externally, then try to fill your gaps, which can be particularly helpful in identifying kind of your need for support and are we meeting it. And then something, now this is very much in its early days at the moment that we're looking to develop, so any feedback from you guys at this point would be fabulous. We're looking to develop something called direct delivery. So at the moment, we don't do direct delivery to children and young people within schools, but if we feel that there is a need for direct delivery, i.e. myself coming into the school, or kind of one of our experts coming into the school to work directly with the children and young people, this is something that we can look at putting together. So please kind of give me a little bit more context on what we're referring to when we're thinking about accessing support, so that I can really start to pull something together that's going to be really helpful and beneficial to you guys as well. As I always say at the end of these videos, please reach out to us, please talk to us. We are on lots of different platforms now. We've just branched out into TikTok as well. Obviously, you know that we guys are in YouTube, and obviously we're in LinkedIn and things as well. So please do, there's lots of ways you can get in touch, guys, so please do get in touch. Have a wonderful week, and I will speak to you all on Thursday.